So today we want to talk about a couple of things. This little dog is here today for a dental cleaning, and dental cleaning is very, very important. Cindy, our registered technician, she's also our head technician, has been doing dental cleanings on dogs and cats for 26 years, so tons of experience, and we love that. So a couple of things that you should always make sure are performed on your pet before any kind of surgical or anesthetic procedure. One thing is an EKG. So you can see our little dog has leads that are clipped onto the legs, and they're little alligator clips, so they do cause a little bit of discomfort, but we're not going to leave them there too terribly long at the beginning. And so then the EKG, this is a beautiful EKG tracing, and we do this before we give the dog the anesthetic to make sure that the heart is performing the way that it needs to. And the other thing that we are going to do is we do blood work beforehand. And so this dog had beautiful blood work, and we want to make sure that the dog is healthy enough for the anesthetic procedure. And if there are any changes that need to be made as far as the anesthetic protocol, we would determine that based on the lab work. The dog also has an intravenous catheter in her front leg. And here goes our IV line to our bag of fluids. And so that bag of fluids is going to run at a rate that's predetermined based on the weight of the dog. And then she's going to get a tube down into her throat to deliver the anesthetic into her lungs. And that will keep her airway open so that we're sure that the dog is breathing well during the procedure. So once we get this dog under anesthesia and get the procedure going, then we'll also look at how the animal is monitored while it is sleeping. Good boy. Okay, so now our little dog is intubated and attached to the gas anesthesia machine. So we can monitor that very closely and increase or decrease the flow of oxygen and gas depending on the depth of anesthesia that we need for the patient. On the tongue, we have this little monitor, and that's called a pulse ox. And what it measures is our oxygen saturation. Yep, just went down a little bit, which means I probably bumped it on the tongue. So we want that to stay above 90%. So Cindy's going to readjust a little bit. And then it also gives us the heart rate. And then back here on the tail, we have a blood pressure cuff. And that can go on a foot or a tail, and there's our blood pressure, and it'll repeatedly take the blood pressure so that we can monitor what's happening with the pet. So all of these things are very important. Here we go, there's our pulse ox back up to 99. We love that, that's awesome. Of course now it's not counting our heartbeats, but it will. There we go, 114. So this is the kind of stuff that's very, very important when your pet is undergoing an anesthetic procedure, and you absolutely need to talk to your veterinarian if your pet is going to have an anesthetic procedure. Make sure that they are taking all these safety precautions with your pet, and that they will be monitoring very closely, and that they have a certified registered technician who will be monitoring your pet, not just somebody who came in off the street and maybe did or did not get any training. You want to know what that person's training is that is going to be responsible for your pet for the day, and that the doctor will be overseeing the procedure. So hopefully this will help you keep your pet safe. And on another day, we'll actually watch a dental procedure and talk about the importance of that.